Welcome, everyone. Good afternoon. Thanks for joining our question and answer session. Today is Wednesday, June 10th. We also want to thank you for trying this new format with us. We have an opportunity to do more of a Q&A and have people listen in while that happens. And we appreciate you joining us to get some information and to get that information in a timely way from us directly. We will be walking through some basic data like we always do, some basic state data as well as our county level data, and then from there we'll answer questions. For those of you that are on, you can enter questions and we will be monitoring that, and you can also talk and share questions when we get to that point and ask out loud, and we'll respond along the way. So first of all, our state status update. The state is reporting now 112,000 negative tests for COVID-19. That's an increase of almost 10,000 since Tuesday. Positive cases are at 21,593, an increase of 285 positive since Tuesday. Hospitalizations of those that have been tested positive, about 14% of those have been hospitalized, 2,943 people. And we now have 671 Wisconsin residents that have died of COVID-19, an increase of 10 since yesterday. Again, it's a disease that is impacting people with hospitalizations and deaths at a rate. This is a new disease, and to have almost 700 people in our state having died from it since the spring is a significant number. The data is being tracked at the state website. You can get really good information there about how the number of new cases has progressed over time, how the positivity rate, how many of the tests that are done, what percent of those are positive, and all kinds of other cumulative data points as well for the state are available at the DHS website. It does show that we've continued to have disease in this state and that we continue to have a virus that is impacting many people. In Eau Claire, we now have 6,149 negative test results, an increase of 98 since Tuesday. Positive cases are at 126 Eau Claire County residents, an increase of 2 since Tuesday. 106 of those 126 have recovered. We do have ongoing reports of outbreaks in this community, and that has been shared on previous briefings, and we continue to see cases of COVID-19 in those congregate living situations that we are tracking and are critically important for us to stay on top of. Our data is also available on our website, and again, that website is covid19eauclaire.org. We are trying to display a whole variety of data points, not just the ones that we talk about during these media briefings, but also a number of other data items that may be of interest to the community. So we certainly encourage you to look at both the state website for state level data and some local data, as well as our local website. And we have links readily available there for a variety of information. So a couple of additional announcements. They were released in a press release today, but are also on our webpage, and we do want to make sure that people see that and notice that. Today, we announced not only our new metrics are available that we look at weekly and post on Wednesdays. We also have a new order that will start after midnight tonight. And we have a newly released planning document that really captures many of the things that we've been talking about for a number of weeks since the Safer at Home order was ended for the state. Those public health principles and our plan to progress through our local order, that is now captured in a document that is available also on our website. We hope people go there and review those materials. Again, if you have questions following looking at that material, please don't hesitate to call us at the call center number. That number continues to be available. That is 715-831-7425. So a couple of pieces of information about those three new items. So first of all, the updated metrics. We look at those weekly. We pull the data from a time standpoint of Tuesday morning through the following Monday night. We look at that week's worth of data, and we post that on our website. The metrics that we're following that we then rank as red, yellow, or green. So you'll see a scale on our website that really looks at that, tells you a bit more about what is happening in the community related to our disease numbers and a whole series of measures around disease, what's happening in our community related to our hospital capacity and a couple of measures related to that, and then what's happening related to our public health capacity or our ability to make sure that as we get increased numbers of disease cases, that we can make sure that they're staying home and not spreading disease out more broadly in the community. So all of those metrics are updated weekly. We post those on our website, and we encourage you to look at those. Overall, this week's data indicates that our positivity rate and our change in new cases, so the difference in cases that we saw 2 weeks ago to the difference in cases now, those measures are going down and they look good in our data. While our overall number of cases is increasing, it's not happening as quickly as it was previously. But we are continuing to see more cases, which is also an important measure. We also don't have any new outbreaks this week, but we continue to see cases in congregate living situations. Some of the areas that we're watching or that we're concerned about, they're either yellow or red, include areas around community spread. Right now, 60% of our cases in the last 14 days weren't able to report where they got sick. It wasn't because of a family member, for example, that they were exposed to. And this is an increase from last week. Also, much of our contact tracing work, our work to make sure we know how many contacts there were for an individual and getting in touch with those contacts, that also has been challenging work the last couple of weeks, and that's noted on the metrics. Finally, about 85% of our contacts were reached in the first 24 hours. But that does mean that we are not reaching all of our contacts as quickly as we need to. We have the capacity for that, and we are having some challenges with getting information on contacts that we're hoping all of you continue to help us with. The more we can follow up with contacts and get them to stay home, the less disease spread will happen in our community. After review of the data and really looking at the changes we made to the public health order a couple of weeks ago, we are now releasing a new order. Again, that order is coming out starting after midnight tonight. That new order does have a question and answer document that will also be available on the document related to it, but you can go to the website and click on that new order now so that you know what is moving forward as of tomorrow. A couple of the changes I'll highlight right now. We have a change for our public gathering section of the order, which previously was 10 or fewer people indoors or 20 or fewer people outdoors in those public gatherings. We've changed that significantly. It's now 50 people indoors or 100 people outdoors, as long as all of the other requirements in the section 2 of the order can be met. We also made a change to recommend some of the pieces under the personal one-on-one services, which is in section 2, moving those from requirements to recommendations. So those are around the daily client limit and a couple of other pieces that are in that section. The requirements for physical distancing, for cleaning, for all of the other pieces in our section 2 of our order remain the same. Those are important public health principles, and we expect many, if not all of those, to remain standing for a significant amount of time while we have disease in the community. Finally, today we released a corresponding document that talks a bit more about how we are walking together through reopening in our community. It's called Responding Together Eau Claire, and it really is talking through the public health principles, the data that we are using, and the planned progression over time to be looking at reopening in Eau Claire. It mirrors many of the plans that you see at a national and a state level. We did draw on those as we move forward, but it talks through how all of us have a role in success with having our community be safe and healthy. The local metrics are the ones that we've been talking about for a number of weeks now, the ones that I talked about earlier that we'll be updating weekly. We talk through in the plan what those are and why we use them. We also talk in this plan about how if they are all green, we move forward. If they are all red, we hold steady or perhaps even have to go the other direction and have more restrictions in place. And if they're a mixture, we really do an evaluation of those measures that are more concerning and how we pay attention to those as we move forward. So for example, if the hospital capacity metrics are all red, we would hold. We would not be moving forward because we know we are at a point where the data is not looking good and we need to pay attention. So again, we describe in that plan a bit more about how that will be working. And finally, in that plan, we really anticipate some of the steps that we will be taking. So for example, the order today moving forward to 50 and 100, the 50 people inside, 100 people outside, that is documented in a grid in this plan, and it shows how we see from a public health principled way moving forward, we would move public gatherings forward as the data allows. This is not a date-specific plan. I know it's hard for people when we have orders that last 2 weeks that people think that in 2 weeks something will suddenly change. It really is saying in 2 weeks we are carefully looking at reopening more. Our goal is to continue to walk through the steps in this plan as you see laid out, but we have to look at the data to make sure that it's safe for both employers and employees and for the customers that are entering businesses, as well as all of us in the community to do that. The virus is not going to magically go away because of a date. It will be something that we have to track with data, and we'll continue to do that. Many of you watching the news have seen that states around the US have hit ceilings where they've said we're in an urgent situation because of our hospitals. We've also seen reports from other parts of the state. Brown County, the Green Bay area, for example, has recently reported that they are having spikes in cases that are creating enormous challenges for their community. So we know that that could happen here if we don't work together and manage this in a way that is continuing to move forward when we can, but also carefully watching the data. So again, 3 documents that you can see on our website, 3 important documents that we hope you look at: our metrics, the new order, and the plan for how we are working together to move forward. I also would remind you that there's lots of other information on our website. There's information for businesses, for individuals. There's a lot more data for those people that want to look at data, and we encourage you to look at that. A couple of questions that we got in advance I'll talk about now, and then certainly we'll open it up for more questions after that. First of all, there was a question related to the jail, and we talked a bit on Monday about the jail and COVID-19 and response to COVID-19 in the jail. I will share the follow-up question was really around more specifically about positive tests for COVID-19 in the jail. The jail has given us their report. They do their own testing for COVID-19, and they have tested 13 people for COVID-19 as they have entered the jail with symptoms and as they've identified concerns. Of those 13, 5 people have tested positive. Those aren't all necessarily Eau Claire County residents. They may be people that are residents elsewhere. All of those people, the health department has worked with, and we have worked with the jail to make sure that they were isolated, anybody that's positive. The jail also, as we talked about on Monday, does quarantine anybody that's new to the jail for 14 days to make sure that during that time frame, they are not potentially spreading disease that may not yet be recognized. All of those individuals that were tested, and the 5 that were positive, were all people that were for a very limited amount of time in the jail and were identified as they were in that time where they were not in the general population of the jail. Again, just to be clear, these were not jail-acquired cases. We consider all of these 5 cases community-acquired COVID-19 that were just happened to be tested for in the jail. And they aren't, again, all Eau Claire County residents. We additionally had a question about the health department, whether we're noticing an increase, a decrease, or no change in the cases of COVID-19 since lifting the Safer at Home order. We're certainly seeing an increase in cases. Our rate of disease has been fluctuating. It's been going both up and down and staying flat. The rate, again, is how many cases out of a population group, typically 100,000, that is looked at. And that has fluctuated over time. We've seen periods of time since the Safer at Home order was lifted by the state where we've had very high counts and our rate has been high. That was earlier in May, not in the last couple of weeks. It's been staying fairly steady the past couple of weeks, but certainly we see fluctuation, and that's something that's shown on our website. We also, as part of our work, are looking very carefully at our healthcare capacity and our public health capacity so we can manage the cases and the change in the rate of cases. We also previously got a question about the change in the order, which we addressed earlier, so hopefully that answered the question, as well as the questions about any changes that are coming and what were the rationale behind them. Again, the rationale behind the changes in the order were really specifically related to having a strong sense that we are building capacity around our public health capacity and able to respond to the increasing cases that we may be anticipating. And we really feel that it's an opportunity to open again and frankly see where things go. We are hoping that the community continues to very carefully follow the distance requirements and all of the other public health measures that are in the order under paragraph 2. That's going to be critically important moving forward. And we think that the loosening of the order that is in effect as of midnight tonight will be an opportunity to look at how we can continue to have a slow progression of disease in this county. Those were all the questions that we got in advance, and I think now we are open to either having people share questions by unmuting or by sending a message, and Audrey will share that with me. So right now, Audrey says there are no questions that are coming in advance. Does anybody else have questions? So you would just need to unmute and share your question if you do. All right, then I will say that we have a reminder to go to the COVID-19eauclaire.org website. You can get a lot of really good information there. Do join us on Friday. We will be back with our usual media 3:30 time, and we will update you with more information at that point in time. Thanks everybody for joining.